I'm not a big fan of Medicare for all. I mean, I welcome the debate. I think that we should have health care for all. I think that the Affordable Care Benefit is better than the Medicare benefit, but it is expensive. Who pays is very important. What are the benefits that come in there?
Lord have mercy on my soul. I'm not for Medicare for all, but I'm for all people having health care and who's pays for it, and it's very expensive. Yeah, it is. But the military-industrial complex is very expensive too. And leader Pelosi, Representative Pelosi, didn't blink an eye. Her and her colleagues, in a bipartisan way, they always find a way to enrich the military-industrial complex. And who pays for it? It's about a social contract because we're already paying right now. The way that we commodify healthcare in the United States of America is untenable. And listen to me, sisters and brothers, family and friends, we're paying anyway. So why not pay in a way that edifies? Trust and believe me, we're paying. You just don't see it, but we're paying. I mean, what she just said there just absolutely makes no sense. So that was Leader Pelosi in 2020, and her ongoing mission of rejecting Medicare for all is now being rewarded by, you know what industry? The hospital lobby. Put up this headline, team. Pelosi gets Hospital Lobbyist Award after blocking reforms. I mean, we can't make this stuff up. A top lobbying group for hospitals on Monday gave Representative Nancy Pelosi, Democrat from California, an award for her, quote, incredible efforts in advancing healthcare, end quote. After the former House Speaker spent the past 4 years fulfilling the industry's top legislative priority, blocking consideration of Medicare for all or any other major reforms to the insurance-based health care system. Now, the lobbying group in question is the American Hospital Association, which put out this tweet. Congratulations to the 2023 AHA Award of Honor recipient Speaker Emerita Nancy Pelosi. Pelosi's incredible efforts in advancing healthcare throughout her career have helped provide affordable health coverage for tens of millions more Americans. I sighed deeply, y'all. I was trying not to. And then when the Lever, our friends at the Lever, shout out to David Sirota and the team over there at the Lever, when the Lever tried to access the event, what happened is atrocious. The Lever was denied access to the war ceremony event at the AHA's annual meeting at the Marriott Marquis in downtown Washington on Monday evening. When our researcher arrived at the event, an AHA staffer said he would contact or connect him with the communications representative, but instead a hotel manager then approached and threatened to have the researcher arrested if he did not leave because he had not registered earlier for the event. Yasmin, I'm telling you, shaking my head and sighing at the same time. I want to throw some papers. I probably will before the show is over.
Yeah, Nancy Pelosi represents to me a woman who was once good at her job, at one point, and is now incredibly just out of touch with modernity to the point that she shouldn't really be in a position of authority anymore. She represents the corporate career politician, the politician who works more for personal gain rather than for the betterment of the people she serves, which makes you wonder, why did you get into government if that isn't what you're trying to do? At this point, it's abundantly clear that these groups that lobby on behalf of America, on behalf of their own systems, right? They are the ones who are infiltrating the American system, the American governmental system, to the point that it is creating problems for the average American citizen. And people like Nancy Pelosi are not helping. She exemplifies what we're talking about when we say that the modern Democratic Party is barely considered to be left wing. They are centrist, if not a little right. The American hospital system doesn't serve the needs of the American people the ways that it could and should. It's extortionist, it's exploitative, and it's able to function that way because politicians in Washington allow it and even enable it to do so. We've been calling for better healthcare in America for years, and those calls have fallen on deaf ears, and they keep telling us that it's expensive. We already pay astronomically higher prices for medical care that is not astronomically better than that which people in other similar nations pay and receive. Then we're told that it's the best that our government can do, and that isn't the case, and we know it isn't the case. It's just the best that they're willing to do.
That's exactly right, Yasmin. Oh my God, I just can't with these people, and for decades, actually, we've been fighting for this. And when even under President FDR, this thing started. It's been a long time, decade after decade, generation after generation. And you know what? We're not going to stop fighting.